Merry Christmas, everybody. It is Wednesday, the 23rd, and today I would like to spend a little bit more time explaining about the supplements that I currently take to help in my healing process. I just did a video the other week about how taking a supplement is not there to help reverse any situation that you're kind of stuck in, but supplements are designed to help us transition from a sick state to a healthy state, as long as we can figure out what it was in the beginning that knocked us off of being healthy and put us into a sick state. So just like major medical, they typically will take medicines based on some symptoms. If you have a fever, take Tylenol. If you have diabetes, take insulin. If you have high cholesterol, take a statin drug. And so we see that we've been conditioned just to chase after symptoms and try to take something to get rid of that symptom. But here at the Wellness Way, what we truly focus on is finding the root cause and eliminating whatever that stressor is that's causing that condition to make you sick. And then we use supplements and herbs and multivitamins. Once we identify your trigger, yes, the body needs some help to go from a sick state to a happy state. But we can't do that just by taking supplements alone. So take a look at the poster behind me. This is what I use to help teach my patients the process in healing. So yes, it takes years and time for a disease to kind of show up in our body. We don't just randomly get sick overnight. Most of the things that we're challenged with health-wise is years and years of exposure to a trauma, a toxin, or a thought. And if we don't correct that, then that leads to sickness, and then that's where we typically will find ourselves. And that's where I found myself in my journey to trying to be healthy with my anxiety and depression. I tried so many different things, different exercises, different diets, weight loss, different supplements, medications. I tried them all because what I was trying to do was take care of symptoms, just like we've been conditioned to. Oh, I'm anxious and depressed, so I'm going to take an SSRI medication, or I'm going to take a benzodiazepine. Because what those do is just shut off the symptom. It doesn't ever treat the condition that's causing the anxiety and depression. So the very first thing that I do with my patients when they come in through the door and they say, "Hey doc, I got anxiety, what can I take?" And I said, no. We don't follow medical in that mindset. We don't just take something because you have a symptom. First, let's test your body and see what your body's saying that it's struggling with. Once we can identify what your body is struggling with, we can then analyze the patient's life and say, okay, what are some things that you may be doing, whether it's the testing that we do here is food allergy testing, we do urine testing, stool testing, and we do blood testing. So we have to test the body to just see. It's kind of like if you brought your car into a mechanic. The mechanic doesn't typically just open the hood and say, I'm going to replace all these parts. They take a little computer now, and then they plug it into your car's computer, and they let the computer tell the mechanic what's broken. So it's no different. We have to plug in our test. We have to draw information from your body and then say, okay, what is the body saying? And then we have to eliminate whatever the trauma, toxin, and thought is that's making the person sick. And so that's the very first thing we do. We have to examine. We have to do a test. We do digital x-rays here at the office looking for spinal abnormalities. That trauma that I was talking about, chiropractic is perfect for physical traumas. Help restore the body's normal range of motion and their ability to bend over and pick up something, or to lift your legs so you can go up the stairs, or twist your lower back getting in and out of the car. Those are all physical traumas that can definitely lead to sickness. So chiropractic is wonderful for that. Then the other ones, the trauma we just talked about, the toxins, that's where we really test. So we test, again, the blood, we test the stool, we test the urine, and we also test the food allergies. So what goes in, how is it working when it's inside the body, and then what is coming out of the body, okay? Once we identify where that stress is coming from, then we can do a specific supplement or herb program or plan for you to, again, help assist in the healing process. It's not going to heal you. It will assist you in healing, because your body will heal itself as long as we take away the stressors. So we can help the body and make things a lot faster and smoother for us by using the supplements. But in no way will the supplement just erase anxiety and depression, because I tried that for 15 years. I tried all the supplements. because I wasn't finding the stressor, it was a waste of time. All right, so when we get to this area, when we identify the stress, we start supplementing to help support the healing process, then it takes a little bit of time. Let's be honest, humans, we're not very patient people. And part of the healing process is allowing your body to have enough time. So, for example, I've been doing really good with my supplements, and I got a little too cocky, and just 2 weeks ago, I stopped taking them because I wanted to see if my body had fully recovered and if I needed to stay on these supplements. You know, supplements are not for a lifetime. They're only used when you need them to transition from sick to well. All right. So, needless to say, I crashed and burned. After 2 weeks of not taking my supplements, all of my symptoms of anxiety and depression and...
I wouldn't say all of them. You were just a little anxious.
Yeah, I was just getting a little bit more agitated. I was doing better going out in social gatherings and things like that. But what does that mean? That just means my body still needs a little bit more time to heal. That's all. So I went back on my supplements because I'm assisting my body in healing. And today, it's only taken me about 4 days to get back on the wagon. And I'm back to where I previously was, thinking that, oh, everything's fine. So it's it's cool that I can experience this firsthand, because it makes it easier when the doc knows what you're going through. It helps the patient really feel more comfortable, because doctors are not perfect. I said it. We're not perfect people, and you know, we're all trying our best on our wellness way journey. So again, it says here, the body takes time to heal. Just think about how long it was being exposed to the harmful stimulus, and then you can kind of get an idea. So for me, 15 years of struggling with my mental anxiety and depression, my low testosterone, and my weight issues. 15 years, and then it's only taken about 10 months so far in my healing process. So great results for how long I've had the diseases. So we're going to go over to my computer, and I'm going to share with you some of the supplements that I'm currently taking. All right, welcome back. All right, so like I said, when patients first come into the office, what we have them do is fill out a questionnaire online, and it's quite extensive. It takes about 30 minutes to fill it out, but we feel that that's what's necessary to really get a good understanding of where you guys are coming from, okay? What's your history? What are your symptoms? What are your challenges? How do you feel? Those type of questions. So we get something that's called a preliminary clinician report. So this pops up on my computer before you come in for your first patient visit. And what that does is it ranks the system of your body in order of the areas that are struggling the most. Now this is what's so unique about the Wellness Way, is looking at the body as a whole. Not just one organ, not just one symptom, not just one spot of the body. We need to understand how all the systems are working or not working together, because that's critical. Because when we expose our bodies to stress, traumas, toxins, and thoughts, everybody's body breaks down differently. So I can take one stressor and I can expose it to 10 people, and they will all have 10 different types of symptoms. Because we're all unique, our bodies have strengths, and they also have weaknesses. So to be able to get a preliminary report such as this is a huge start in seeing exactly where we need to start our testing. All right? So once we see the systems that are struggling, we go in and we let the body talk to us. And we say, hey, what are you doing with the current situation? How are you responding? And so, like I said, food allergies will tell us a lot about you. Your blood work, hormones, thyroid, testosterone, estrogens, all of that. That helps indicate which organ systems are struggling, if they're even communicating to each other. The other one's urine, and the other one is stool. You know, what goes in has to come out. So we want to see what healthy or unhealthy amounts of things are coming through the urine and the stool as well. So again, this is just Megan's right here. Megan, she's on her journey to wellness as well.
A freaking mess, according to that.
She's a mess. She scored a 417.
But when did I take that, though?
August 13th.
Oh, yeah. So that was a while ago.
Yeah.
It's probably better now.
Yeah.
I
So
should
again,
do that.
this just gives us a really good head start, so we don't have to sit here and talk for hours about things that you put on your paperwork. This just makes it super simple. So as soon as you come into the office, we're moving. We're not wasting time. Okay? All right. So again, once we get our blood work back or testing back.
Did you explain how that information, like where that comes from?
Yeah.
The FAQ?
Mm-hmm.
Okay.
Yeah. Okay. So this is part of your new patient paperwork. All right, so next thing, once we get your testing back, then that's where we start to eliminate the stressors, the traumas, the toxins, and the thoughts. And then we move on to the supplementation to help, again, in the healing process. So the first one that I'm currently taking, it's called cod liver oil. And this is a really fantastic, clean omega-3 and omega-6 supplement. I do typically eat quite a bit of fish throughout the week, maybe one or two fillets a week. I have something fishy, and so I do the omegas because I have a family history of heart disease, and part of anxiety and depression is inflammation, and I'm being able to support my cardiovascular system and my brain by taking the omega-3s and 6s, okay? The next one's called kava. I think you guys have seen this a few times in my video, but kava is a wonderful herb that's basically a Xanax in a bottle. It works incredibly well to help relax you and to mellow you out, and it doesn't make you drunk or it doesn't control your brain like an anti-anxiety or depression will, so you can take it and still go and function normally throughout the day. So that's a big blessing, because I've been on medications that if you take it, you're done for the day. You're not even here.
You're like a zombie.
You're a zombie, or things just don't make sense.
But kava does even more than just ease anxiety.
Yep. So here are some of the benefits of kava. It induces deep, restful sleep. Super important for people with anxiety and depression. So that's part of the thought process that we do for healing, is making sure that people are actually getting good sleep, quality sleep. And so kava is a big one for that. It reduces migraines. Headaches, promotes wound healing. So one of the biggest steps in the beginning is healing the inflammation, whether it's in your intestines, in your blood vessels, or it's in your organs. Kava does a good job of decreasing that inflammation so the body can start healing. All right, next one is the general pain reliever, muscle relaxant. It boosts sociability. So of course, if you're not inflamed and you're not in pain, you're going to feel a little bit more open to socialize, and that's pretty cool. All right, it's going to stimulate your dopamine receptors. Dopamine is one of those hormones that makes us feel good. It's what when we look at Facebook or YouTube or we do play video games, dopamine is released in our bodies, and that's what makes us addicted to the social media and the games and the TV shows, is because it's something that our body will produce to say, this is good, but, Facebook and all that, they're actually made to stimulate that way too much, and then we become dopamine addicted. So that's a whole different subject, but I just wanted to indicate what the dopamine is. It's your feel-good receptors, so this helps make you feel better because of that. All right, then it basically will reduce your hyperactivity, so if your brain's bouncing all over the place and you have a hard time focusing, kava's for you. The next one is boost immunity. So our immune cells come from our bones, and if we're stressed and our sugar levels are high and our cortisol is high, that's going to knock our immune system down. So kava can help boost us by relaxing us, get our cortisol to go down, and that helps regulate our sugar, which then helps our immune system show up and be shiny and clean. Okay? So that's just kava. That's just one. That's really cool. And again, I could take if I didn't change what my stressors were, I would take these forever, because I would be forever starting that fire within my body. But now that I know what my stressors are, where my organs were struggling, then I'm properly supporting my body through my healing phase. But I will not be on these forever. Next one is ashwagandha. Ashwagandha is a wonderful herb that's used for inflammation and autoimmune disorders. Here on this page it says promote an overall feeling of well-being. You know, in the year 2020, who couldn't afford to have a little bit more well-being in their life? And it also is a good support for people that are aging. So I'm 37 right now. I don't think I'm aging, but I am getting more gray hairs than I used to. The next one's called Passion Flower. This one is fantastic for men and women. It's an aromatase inhibitor, and what that means is basically if we deal with high levels of estrogen, whether your testosterone is low and you need to help pick that up, or if women have too much estrogen and they're having things like PCOS and all the uterus issues, then passion flower is a great way of taking things that are too high and just kind of making them mellow out. So taking a look at the benefits of passion flower, we have reduced insomnia. So again, sleep. Getting people to fall asleep and stay asleep is a huge blessing when it comes to our mental state of being. So we talked about the other one, which was kava, that helps, ashwagandha helps, and then passion flower as well. So it reduces your insomnia, decreases the inflammation in the body, decreases anxiety, aids healing in skin irritations and burns. So again, here's a fun fact, is our skin is actually an excretor. We use our skin to release things that have built up in our body through sweat and through our skin itself. That's where eczema and psoriasis typically will come from, is when your kidneys and liver and your intestines can't eliminate toxins fast enough. That stuff builds up in our system, and our body uses the skin as the last ditch resort to try to push that nasty stuff out of our body, and it shows up on top of our skin as eczema and psoriasis. So don't treat that by putting creams on it, because you're just reducing the body's natural trying to get rid of it. If you put cortisone cream or anything like that on it, it's just like telling the body to shut up. So it doesn't fix that you're internally trying to eliminate things. It just takes care of the blemish that's on your skin. But eventually it always comes back. Okay? Reduce the symptoms of menopause, including hot flashes and depression. I can stop there. So yeah, I have a lot of female patients, 50 to 75, let's say, and passion flower has been a wonderful help, assister in having them recover from the hot flashes and the premenopause. Again, menopause shouldn't be something that we freak out about. Unfortunately, it's been kind of told to you that menopause is the worst time in a woman's life, but actually it should be the best. So don't fall for, or don't become a victim of menopause. Don't let it get you down. Okay. Reduce the symptoms of ADHD. Again, a lot of inflammation in the brain will cause attention deficit disorders or hyperactivities. We get the inflammation to go down, and the kids start to regulate and become normal again. Kids are never normal. As soon as I said that, I was like, no. Okay.
Normal for children.
And then also benefit for the diabetics out there, it helps reduce your insulin dependency. The next one, it's actually not a liquid, it's actually a capsule like this. It's called Alcidonia, and this is one of the ones that I'm taking to help me transition from taking medications to not. Alcidonia does a lot of really cool stuff. It helps support emotional stability. Again, who doesn't need more of that in the 2020 year? Supports proper sleep function. Again, you notice there's a theme with sleep. Sleep is a vital process that our body and brain has to go through to kind of wipe itself clean every night and then wake up with a clean slate. If we don't get good sleep, we start carrying over emotions and issues from the past couple days, and then it just turns into a giant snowball. Alright, so calming effect on the nervous system, supports the neurotransmitter production. Neurotransmitters are chemicals that nerves use to talk to each other, and we need that in order to help feel stable so we don't get too high or get too low. And then it basically helps calm down the central nervous system, which is our brain, our spinal cord, and then our peripheral nervous system, which are the nerves outside. So if we're having neuropathies, like pain going down our legs or down our neck into our arms, Alcidonia is a great one to help reduce that.
I should take that one.
The very last one is called astragalus. Astragalus is wonderful. I like taking this one. It helps support healthy adrenal and digestive function. So our digestion is top priority always, because we cannot be any healthier than the health of our intestines. Our heart can't be healthier than our intestines. Our brain can't. If our intestines are sick, then that will automatically stress and reduce the function of every single organ of the body. You can't get around that. You know, I always say on a car, we have an air filter that cleans the air as it comes into the engine, and then you shoot air and gas together and it explodes, and that's what makes your car go forward. But our intestines is like the air box. It filters everything that gets into our body. If our intestines are damaged and we're not allowing oxygen to get into the engine, then it doesn't matter what kind of tires you have. It doesn't matter what transmission you have. It doesn't even matter what kind of gas you have, because if the air can't get in, your car's toast. It can't work. And I'm sorry if you guys don't know cars very well, but I like cars. Cars and bodies, they're actually quite similar when it comes to function. All right. Next one is the adrenals. So again, women and men that have thyroid issues, did you know that you cannot diagnose a thyroid condition without first checking the adrenal glands? So you can only have a true dysfunctional thyroid once you get your adrenals assessed. That's in all the major medical books, but today that's not what they practice. So they know better, but they don't practice that. So what they'll do if they think you have a thyroid issue, they'll test TSH or T3 or T4. Well, that's not good information, because again, you're chasing a symptom. The real issue may be your adrenals. So astragalus is one of those things that if you do have a true hyperthyroid, and then astragalus would be a wonderful assistant to help you overcome that. Okay. Next one is buffer the effects of stress, promotes a healthy physical, mental, and emotional response to everyday stressors. So again, who couldn't use a little bit more astragalus in your life? And that is pretty much it. So again, thank you guys for joining me. The things that I shared with you today is for me. This is a personal plan that I have been able to establish for my health and with my goals. Taking the process to go through filling out your new patient paperwork, allowing me to see your preliminary clinician report. Then when you come in, sit down, I talk about the results and what that means, how it's going to lead us into testing to help get a better picture of what's not working right in your body. Eliminate the stressors, the traumas, the toxins, and thoughts. Get you set up on some supplements if needed. And if they are needed, for how long? That's the fun part. Is typically we should be healthy individuals all on our own, as long as we're doing things right. So Merry Christmas, Feliz Navidad, all that good stuff. I hope you guys enjoy your families and friends. If you're feeling stressed out, we're all feeling pretty stressed out. So if that's something that you want and need help with, give us a call. We're always here with a smile to help you out. Megan, do you have anything you want to say?
Merry Christmas.
Merry Christmas. Thank you guys. Enjoy your families.